So continuing on, I said in the last video that you use BMI to estimate your kind of total body fat, but it's actually abdominal fat, so fat that you carry around your middle, and that's particularly bad and most linked with cardiovascular disease. So rather than getting your BMI, which is just your total body fat, to see if you're at risk at cardiovascular disease, it's more accurate to calculate your abdominal fat. So how much fat are you carrying around your middle? And in order to do this, you take your waist to hip measurements. So you take out your tape measure, you measure around your hips, and then you measure around your waist, which will just be just above your belly button. And you'll divide one measurement by the other to get your waist to hip ratio, and that will tell you what your abdominal fat is. And that just gives you a better indication if you are at risk for cardiovascular disease. Then, kind of moving away from fat, smoking is another high risk factor for cardiovascular disease. And the reason is kind of similar to what we'd seen before, that substances from cigarettes, they can block your blood vessels. So that image I showed you in the last video of the blood vessel becoming blocked with what looked like fat, and the substances in cigarettes can do the same thing. They can block your blood vessels and make it difficult for blood to flow throughout your body. So as well as eating a high-fat diet, smoking can have a similar effect and can lead to damage of your blood vessels. So they're the two kind of main lifestyle factors that we're going to look at that can lead to cardiovascular disease. But the final thing that we're going to look at is just how you can treat cardiovascular disease. So because we've said that the main causes are lifestyle factors, so having a poor diet, maybe not exercising enough, smoking, one of the things that you can do to treat some cardiovascular diseases is just having a change in your lifestyle. If you've got high blood pressure, you may be advised to exercise more or give up smoking. Similarly, if you're obese and they think there's a chance it might lead to some cardiovascular diseases, you again could be advised to just change your lifestyle. However, in some cases, a lifestyle change is not enough. The disease may be too far gone and more drastic action may be needed. And if that is the case, then you might have to have surgery. One such surgical procedure, if you have a blocked artery, for example, you can insert a stent to hold that vessel open. And I'm going to show you a picture of what I mean by that because it makes it easier to explain. So if we look here at the diagram that I've got, okay, so these images here all represent a blood vessel, and you can see here that there's lots of kind of plaque building up in this blood vessel, making it difficult for the blood to flow through. And what would happen is you would insert a stent, okay, which is this kind of wire mesh. And that wire mesh, it doesn't get rid of the plaque, but what it will do is it will hold the vessel open and stop the vessel from narrowing and stop the vessel from collapsing. As long as the vessel is held open and the blood can flow through, it doesn't matter then that you've got that bit of plaque or that bit of fat there. And the way that they insert these stents is if you look at this photo over here, okay, so they'll actually make an incision just on the inside of your thigh, and the stent, this little wire mesh thing, is on the end of a long piece of wire, and they'll thread the wire through your leg the whole way up through your blood vessels and into your heart if that's where your blockage was. And when they get to the site of the blockage, and they'll monitor this, they'll be able to visualize where they're going using imaging techniques. They'll be able to see the vessels and guide the wire the whole way up to your heart. And when they get to the part that's blocked, what they do is that wire, that stent is clamped around a balloon. And when they get to the correct site, they inflate the balloon and it causes the stent to open out. And once the stent has been opened, then they just pull the wire with the balloon back out, and that just leaves the stent in place. So obviously the stent itself is too wide to thread the whole way up through your body. So they have it, the stent is kind of collapsed onto a balloon, and it's not until they get to the right side that they inflate the balloon. It causes the stent to open out, then they pull the wire with the balloon back out and it leaves the stent in place. And that stent will hold that blood vessel open, and even though you still got the plaque there, you can see in the picture, once the stent is there to hold the vessel open, the blood will still be able to flow through. Okay, so this is a really, really common way of treating blockages in arteries. And because you're just making this little incision in your leg, it's not like having to go in for a full operation. This whole procedure would take around half an hour. The patient is numbed, but they're still awake. So compared to other types of heart surgery, if you were to have a different type of heart surgery, instead of using this technique, if you consider where the heart is in your body, you would have to crack open your chest. So you'd have to have like a long incision made here going the whole way down through your chest. And you'd have to pull your rib cage back a little bit in order to be able to access your heart. It'll be a big operation. There'll be a very long recovery time from it. With this procedure here, you don't even have to be put to sleep. So you don't have to have that anesthetic. You're just getting a small little incision in your leg. And then they can guide that stent the whole way up to your heart, and you're back out of the theatre 30 minutes later, and you can go home on the same day. So this coronary stent is used extensively for people who have blockages in their heart. Not blockages in their blood vessels. Okay, so that's one way of treating a blockage in a blood vessel. And then other treatments for cardiovascular diseases are just medication. So again, it will depend on what exactly is wrong, but there's lots of different medication that you can go on. And in some cases, it might be lifelong medication, that you're on this medication for life. If you've got really high blood pressure, you might be on medication for the rest of your life in order to stop that developing into a more serious problem. Okay, but they're the three kind of main ways, just the general ways that you would treat cardiovascular diseases. Obviously, depending on what was specifically wrong, there's lots of different surgical procedures and there'll be lots of different types of medication, but they're the three kind of general categories of how you would treat a cardiovascular disease. I am going to get you to do some questions for me now based on what we have just watched. So I'll get rid of my answers. Can you see that? Yep. There we go. I can see that. So if you just press pause, what I want you to do is I want you to answer these 10 questions in your book. When you are finished answering the questions, then press play, and you will see the answers, and you can mark your work. So press pause here, do the questions by yourself, and then press play when you are ready to mark your work. Okay, so here are the answers. The first few should be self-explanatory. It's just straight from the notes that we took down. In number 7, when you're saying that it's non-communicable, make sure you're saying why. Okay, so the reason heart disease doesn't spread from one person to another is because it's not caused by pathogens. Remember, it's the pathogens, the viruses, the bacteria, the protists, they're what can spread. If cardiovascular diseases are caused by lifestyle choices, which we've seen, that's not going to spread from one person to another. When you're talking about the weightlifter, okay, so if you've got a weightlifter who's got lots and lots of muscle's heavier than fat. So if you've got someone that has lots of muscle, they're going to be a very heavy person. And if you look at the BMI calculation, one of the measurements you have to put in is just how much you weigh. And because a weightlifter has so much muscle, they're going to be very heavy people, and they're going to end up with quite a high BMI. That does not mean that they have high body fat. It just means that they're heavy. And in this case, they're heavy because they've got lots of muscle. They're not heavy because they've got lots of fat. So in cases of the kind of extreme athletes, the BMI is a really poor indicator, and it's not accurate at all. In question number 9, I mentioned that abdominal fat is the fat most closely linked with cardiovascular disease. So if you've got lots of fat around your middle, you're at higher risk than someone who's maybe carrying fat on their hips or fat on their thighs. So because abdominal fat is the kind of most dangerous, if you get your waist to hip ratio that measures how much abdominal fat you have compared to the BMI, it's a measurement or an estimation of your total body fat. You're more interested in abdominal fat, therefore the waist to hip ratio is a better measure. And then the last one, you can just insert a stent. Okay, you don't need to be able to go into detail on that. Just insert a stent and specify that will open the artery, and because the artery is open, the blood can then flow, which will fix the problem. So if you've got any questions on any of this, message me on Teams during the lesson time. I'm going to be putting a quiz and show my homework, which will be due in next Friday. That is going to just be a series of multiple choice questions based on the content in these videos, the first few videos that you have watched. So if, as long as you've been making notes from these videos, you should have no problem no problem answering those quiz questions. You don't need to submit me your classwork. There are just too many of you for that. Just make sure you are taking your notes and doing your classwork. And then when you do your quiz, the scores you get in your quiz will be an indication to me of who is completing their classwork properly. But you don't need to submit me your classwork.